Welcome to the office.
Buenos días, Gloria. Mucho gusto.
Gloria.
Now, gracias. How can I help you? Tell me what's going on here. Why don't you come over
¿Cuál
here?
es su problema? ¿Cómo le puede ayudar él?
Pues es mi problema de la cadera para
Okay.
abajo.
Her hip and down is her
Todo,
pain.
todos los pies hasta abajo.
The legs, everything
Aquí
hurts.
me arde, aquí
It
me
burns on
duele
the side.
mucho. No me deja para hacer fuerza.
She doesn't feel strength in her legs.
Okay. How long has this been
Se
going
me
on?
quieren desmayar luego
They
los
feel like they
pies.
just want to bend. They have no strength.
So
¿Qué
there's
tiempo
pain.
tiene?
Hold on. There's pain in the back. There's weakness in the legs. Is there anything shooting down her legs?
¿Siente algo como que si le manda una corriente de algo o nomás
No, de aquí no.
Okay.
Nomás es de aquí,
de atrás, from the
de
back?
acá, sale así y sale todo y
So it
atrás.
starts from the
todo,
back and it
todo,
goes down
todo.
to her feet.
And how many years have you been
Y
dealing
me
with
duele
this?
mucho
¿Cuánto
dolor.
años? ¿Cuánto
¿Cuándo,
años?
Hasta el 10 tuve anoche.
no, ¿cuánto tiempo tiene con este dolor, abuelita?
Sí, en noviembre.
Last year in November. ¿Hace un año en noviembre?
What
Sí.
happened?
¿Qué
What
pasó?
happened last year in November?
¿Qué pasó para que el dolor empezara o así nomás amaneció?
No, así nada más comenzó, que caminando, este pie comenzó primero
It started just with the right leg first.
que era este tendón como que se me
She felt
dobla,
like a
quería
tendon.
doblar el pie.
It just wanted to bend.
Ajá, y le comencé casi a echar el peso a
And she
para
started
que me
putting the
ayudara.
pressure on this leg.
Y
on that leg.
después, pues ya se enfermó el otro
And
también.
then she feels like both of the legs
Ya
got-
son los dos
So
ahora.
started on the right, she
Yep.
compensated to the left, then she started to feel the left side as
Yes.
well.
Mhm.
Got it. And right now, in terms of her movement, is she able to walk?
Ahorita
Like,
con
is
su
she able
dolor.
to walk 5, 10, 15
Sí
minutes?
tengo dolor ahorita.
¿Cree que puede
como
usted caminar como de 5 a 10 minutos? ¿Puede caminar
sin sostenerme?
con que se detenga con algo?
Sí,
If she hold
camino.
herself with something,
Sí
she could
camino,
walk 5
pero
to
me
10 minutes.
molesta
So she
mucho,
needs
tengo
the
estar
walker.
parada.
But it hurts her to be standing a lot.
Estar parada me molesta.
To be
Pero
standing.
sí, caminar, sí camino.
She could walk
Ajá.
if she's holding on something.
As long as she's holding on,
Holding.
so she has a balance issue.
Mhm.
So is the holding something because of balance or pain?
Pues me agarro, ando más con un bastón.
Ajá.
Con un bastón.
With a cane, por el balance, porque siente que se va a caer o porque
Sí, por eso.
for the balance. 'cause she
For the
uses
balance,
yeah.
okay.
Sí.
Mhm.
And before last year, did she have any balance issues?
Sí, pero no mucho, no, como que de repente nada más me dolía, ¿no?
I don't know
Así.
where it will come,
Y ya
but-
cuando apareció más duro, ya fue desde noviembre, más duro.
November started getting worse, but prior to that, it was like once in a while she has some pain.
Her breathing is very low and her digestion is, we need to talk about as well in this visit, okay? And it all relates back to what's going on, okay? We'll start to put pieces together of what the condition is and kind of figure out where we're gonna start. But you don't live here,
No vive usted
No.
aquí.
okay?
No.
So,
Sí, vi a unos traumatólogos.
She went to some doctors in Mexico, but
Ajá.
okay. She's coming from Mexico.
from Mexico, yeah.
Okay. Guys, this is gonna be a fun journey and we're gonna see how we can help her for
Dice
this
va a ver
month.
cómo la va a poder ayudar en este tiempo que va a
Sí,
estar usted
sí,
aquí.
cómo
porque
no.
And
para
we'll
él,
Primero Dios que me va a ayudar y me va a aliviar.
first name of God, she will be better. Hopefully,
Amen.
she has faith.
Okay, so we have some work to do, and
Hay
we have
trabajo que hacer, hijo.
some things
Tiene
to talk
trabajo que
about.
hacer
Mm,
en su
Sí.
cuerpo.
Because she's got quite a few things going on in her spine we need to talk about. So what we'll do is I'll go over her x-rays. After the x-rays, we'll do the exam and figure out where we're going to start.
Okay.
If she's uncomfortable with anything that I'm doing, you tell me to stop, please. It's gonna be a little spicy, maybe.
Pero va a estar un poquito picante el tratamiento, pues
Sí, sí,
no va a ser
poquito.
fácil.
Un
porque
poquito
hay
fuerte,
mucho-
¿no?
Sí.
Picante, picante, no fuerte. She's watched any of my videos. She knows how I am.
No, she has not watched any videos.
Oh,
Only
okay.
my uncle.
Okay, sounds
Yeah.
good. So that's uncle.
Uncle and then my brother, that's her
So-
son.
That's her son, and that's your uncle. Okay,
Yeah.
I got it. So now
Yeah.
I'm starting to put the pieces together. Okay.
Yes.
Lista?
Lista.
Okay, let's get started. When we're looking at the human body, we're looking at the entire spine, right? So things that happen down below can affect up above and vice versa. And I know she's complaining of all of this. And just as well, there could be something hiding up in here that's causing some of the pressure and the pain. Okay? Now, when we look at the x-rays, she got quite a few things going on here. And let's start over here. She's complaining of her foundation and going down the legs. And as we can see, we do have an imbalance in the pelvis. We can see one side is shorter and kind of twisted. And we'll go over the numbers in a little bit. The next thing we can see is, so we see the right side is short, causing this kink or this curve, this convexity on the right side. The body compensates to the left and it comes back to the right. The thing is though, we have all this arthritis happening in the spine. And that's the body trying to stabilize all the instability she's had all these years, okay? So this isn't stuff we're dealing with. Now, as I start to make changes, this is kind of important. As I start to make changes in her foundation, things are going to be moving around. She may get some pops and crackles in her low back that she didn't have before. Things are shifting around. I just want her to be aware of that, okay? And check this out. So, I'm talking about these hooks here. These are all hooks, hooks. Okay. Now, we'll go into more detail of the low back in a minute. I do want to talk about her digestion. And I will then explain how I see this case for her and the best that I'll be able to do. Okay? She does have a little bit of low bone density signs. But the way I see it, as Dr. Gonstead taught it, was when we see low bone density on an x-ray, female, over 40, digestion. Okay. When we have low bone density, first thing is digestion. We know we have a digestion issue here. And how do we know that? Well, the first thing is she had her gallbladder removed.
Right.
And if someone has had their gallbladder removed, I know they have an acid issue, an HCl issue, and they weren't able to activate that gallbladder. Number one. Number two, I'm looking at what we call the Blvd. This should be a big black half circle. Number three, I'm seeing a lot of undigested food going through the colon as it's coming down, more so when it's going up and across. Now, if we're not absorbing and assimilating our nutrients effectively, then we're not even getting the calcium out of the food. So a lot of times there's another big misconception. They think that I have low bone density, so let me just start eating calcium. Calcium is ubiquitous, means it's everywhere. It's how do you get it out of the foods that you eat? Well, a couple of key nutrients you need to get out of the foods, but it requires that HCl. One is the calcium, iron, and B12. All those require the acidic medium. And when we're not getting that, we're getting those nutrient deficiencies, which could lead to other things in addition to the low bone density. Okay? Does that make sense?
That makes sense.
Yep. Now, let's look at this low back on the side profile. And it is also a little misleading. So when we look here, we see L5 is back. L5 is tilted like this. However, her sacrum is back posterior. So it looks like the L5 is wedged, but in reality the sacrum has gone slightly posterior. Here are a couple of things that we need to now talk about. We have a sacrum issue, we have a rotated, it's a slight zero rotation, but it's dropped on the right side. So her tailbone is going down like this on the right, number one. Number two, I'm going to just reference the left pelvis. The left pelvis goes up and it turns out. So the sacrum drops down, the pelvis is up and out. That's the imbalance or the disconnect. Does that make sense?
Yeah.
And she has the short leg. This needs to get under 7 millimeters or nothing will hold. Now, the reality is I can't even put a heel lift in here. Because if I do, look, typically the contraindication of a heel lift is if the convexity is opposite the short leg, which this part is. So if I put anything in her right leg, it's going to make her mid back worse. So we don't want to do that. So we're gonna have to figure out how to get that tailbone up on this trip, okay?
Okay.
Putting it together now, we have the imbalance in the foundation. We have the right SI joint that we have to look at. We have S4, S5 to look at. We have to see how we're gonna bring it up. Anything going on here related to digestion. And of course, we need to check the upper cervical for her. Starting at the base. And the first thing we're getting is 25 points up top. Atlas occiput, left side potential. 15 points. It's a little lower, around T7, T8. Let's see what we got. Around T7, left side, 6, 7 points. It's low, S4, S5, 10 points, old injury. This is an old injury she had. S4, S5, around T6, T7, and up top left in the penthouse. Let's go ahead and feel what's going on. Now, in her case, we're going to do it this way. Check the top of the joint, back slowly. Top, middle, ¿duele?
Sí.
Mucho duele abajo
Sí.
or arriba.
Ay, ahí está.
Okay.
Ay, duele.
Okay. Arriba, mucho duele
No.
arriba o abajo.
No.
So
Ay, no.
her
tanto.
left SI is okay. So
Fue de
this,
este lado más.
sí, so it is the right SI. Now, número 5, okay? Número 1, ¿duele?
Ah, sí.
Número 2,
Ay,
sí. Número 3,
Ay, ay, sí.
ay, ay, ay. Número 4, uno más. 5.
Ese no tanto.
Número
Los del
4,
medio, sí, por
sí.
ahí.
Oh, wow.
S4 is where it's starting.
Mm.
Bueno, look down here, please. 2, 3, 4, 5, 6, 7. 7 or 6. ¿Duele?
Ay, sí.
7 or 8.
No.
7.
Ay, sí.
6, no. 7.
Ay, sí.
7. T7, S4. Sit back for me, please.
Pues hágase para atrás, hágase para atrás. Ahí.
Bueno. Okay. And she gonna get some magic socks today. Okay. 6, 5, 4, 3. Aquí.
Ujú.
Sí. Sí. Turn left, turn right. Divorce test, up and left, up and right, down, down and left, down and right. Huh. Down, down in, down in, that's fine. Look up and left, up and right. Okay. Okay. Let's formulate a game plan. Let's formulate a game plan.
Why do imbalances happen? Like, is it through age? Or
What do you
is it-
mean, why do imbalances happen?
Like, why is it so uneven, putting pressure on one?
That's a fantastic question. Why do imbalances happen? Life is about balance, right?
Right.
We are designed to be in balance with nature. That's how we're all designed. And we go through life, we have slips, falls, traumas, life happens.
Right.
And as an example of, as a kid, we play, we slip, we fall. 80-90% of the time everything is fine, but what about that one time it doesn't? It doesn't go back to where it needs to go. Then what happens is the body starts going through this compensation mechanism and we start to adapt.
Mm.
Okay? When we're looking here, she had a couple of major traumas.
Yeah.
If we see a -7, a 7 millimeter sacral inferiority, the sacrum didn't form right because there was some trauma. Number 2, an ASEX, the way the joint is, if it goes AS, it should normally go up and in. If we see a listing up and out or down and in, we know there was a trauma associated there. So we know we had a pelvis issue, we know we had a sacrum trauma, we know we had the short legs. So all of this combined created that process. Then she also has the upper cervical.
Right.
Okay, so the body has compensated. She's been working through it. I'm sure she
Yeah.
never complained. You know, she just had to take care of family and
Yeah.
take care of business, right?
Yep.
And now, who's taking care of her?
Now it's granddaughter.
Now it's time for you guys,
For
right?
us,
Step
family,
up.
yeah.
Okay, Senora, let's get started. Number 7. 1, 2, 3, 4, 5, 6, 7. We're going to set it as a PL. And we're going to set S4. And we're going to do a counterclockwise torque. Would you like to come help over here?
Yes.
And all I want you to do, stand behind her.
Okay.
I want you to just place your hands lightly
Okay.
on the side. Okay? Bismillah. Uno, dos, tres. See? She's a tough lady. Bueno. You got her?
Yeah.
Bueno.
Hey!
Poco. Poco. Poco.
Hey!
Gotcha. She's a tough lady. Okay. Bueno. 2, 3, 5, 6, 7. Gotcha. Nice. Okay, we can step back for a second. And then what we'll do is we'll transfer her here to do the neck.
Okay.
Okay. Para.
Okay. Despacio.
Okay.
Ahora se va a sentar otra vez en el asiento. Despacio.
Don't worry. I know it's tough seeing it. I got it.
No me fijé.
Oh man.
Agarre su mano de ahí, agarre su mano y se va a sentar ahí.
Sentate aquí.
Ahí.
Sit back all the way.
Para atrás, atrás, atrás.
Left. There you go. Okay. Stand up with her and walk with her without the walker.
Ok, vamos a caminar abuelita aquí.
If you come over.
Sin que nomás yo la detengo y vamos a caminar.
Okay.
Camina.
Walk to the corner of the room,
Véngase
please.
para acá. Yo la... Calmada, no me corra. She wants to run. Come.
Diferente.
Sí,
¿Cómo se
muy
siente?
diferente. Sí.
She's all like taking off. Like, wait for
Walk
me.
again. Walk
Otra
one more
vez,
time.
Véngase para acá. Cuidado, ¿eh? ¿Cómo se siente?
Sí, diferente. Ya me de.
She feels different. ¿Mejor o peor?
Ay, no, mejor.
Better.
Siéntate aquí, por favor.
Sentadita ahorita. Eso.
Seven is clear. Sacrum is clear. Clear. Okay, let's continue. More balance. Okay, shoulder. Bus. Shoulder. Bus. Now, we're gonna do the buff and polish on her back. This is to break up scar tissue. And we'll do this for a minute, then the last thing we wanna do is her ankles, then we'll give a bunch of instruction, okay? You got it. She worked hard.
Está bien.
She worked real hard. I see it in the spine. A lot of physical work.
Oh, yeah.
She used to carry a lot of the food in here with her back and drive all the way to the country to
Vegetables?
provide food.
Okay, now, I want her, nobody gonna help her.
Okay.
She's gonna get up by herself, she's gonna push up off her knees like this, and she's gonna walk once.
Abuelita, se va a levantar así, se va a poner sus manos aquí, párese usted solita, yo no la voy a ayudar. Párese, ponga sus fuerzas en las piernas y párese y camine. Eso, ándele, muy bien. Muy bien. Eso, abuelita. Fuerte, abuelita. Eso.
Bueno. Now, let me go grab something, I'll be right back.
¿Cómo se siente? Que no la ayudé, se pudo parar bien.
Sí, me pude parar bien, sí.
Sí.
What size is her shoe?
I don't know actually. ¿Qué size is
I think
Oh, 9. USA 9.
Okay, now what we're gonna do, sit back over here, take her socks off please.
Okay.
Now I show you the other magic, okay?
Okay.
And I will talk about this stuff more later. US ones. Yeah. Okay, so I'm gonna prescribe these socks for her. I'll explain what it is. She's gonna tell you right away the difference. And these socks, I've been using them for about 3-4 years. This is the technology. And the technology is this stripe. And with this stripe, it's actually activating some neuroreflex points. And 3 things it's going to do. She'll tell you. 1 is less back pain. 2 is more trunk range of motion. 3 is more ankle stability. Now, I want her to wear them at night in case she's getting up to go to the bathroom. Make sure there's no falls. Okay? So let's go ahead and put these on. Go ahead and put that on.
You only recommend them at night, so not like a
No,
daily
she
use?
wear them all the time.
Oh, okay.
Oh,
okay.
no, but I'm saying I want her to
Oh,
also
okay.
wear them at night.
Got it.
This is not fixing the stuff.
It's just-
Right.
This is allowing her to move so she can heal. Because the body heals with motion.
Oh, sure.
Gracias.
And then she's gonna tell you. Señora, vamos, let's walk.
Igual.
Camina.
Check it out.
Mamá.
Check it out.
¿Cómo se
Okay,
siente?
muy mejor.
Sí, sí, está aquí duele poquito todavía, aquí duele.
Va a guardar, tenemos que venir el miércoles.
Pero ahorita ya como se sentía como está ahorita.
You see the difference?
Yeah.
You see the difference? That's where we're gonna start, guys.
Yeah.
One day at a time, okay?
Yes.
And to wash them, better to wash by hand, or you can do machine, and hang them or air dry, don't put a heat.
Yeah.
They'll last a long time, okay? Siéntate aquí, last thing we're gonna check. Let's scope the back.
Ya se sentó, está solita.
And then we're gonna give her a bunch of homework. Doesn't matter who you are, what you have, everybody has a spine, everybody has a nervous system. And when there's interference between brain and body, body cannot function at its best. And the body goes through compensatory mechanisms, and then we get all this stuff later in life. And the take-home message is keep the body moving. And when an injury happens and you're feeling it, something doesn't feel right, get checked. All good. Okay, we're all set for today.
Okay.
I just want to do one more thing on her hands. Stand up, please, señor.
Parece abuelita.
Come stand over here.
Parece ahí enfrente de él.
Turn
Con
and
la
face
otra
me.
mano.
Raise your right leg.
Hace su pie derecho.
Mira. Keep it up. No, up.
Déjalo para arriba. Eso ahí.
No, don't. She's ambitious.
No. Ay, sí, no.
Okay, raise the left side.
Ahora el otro pie, abuelita. Eso, así.
Ay, Este,
Use
¿no?
my hands, yeah.
Ese.
Yeah. So the right is tougher, and that's the one
Yeah,
that.
that's right, the right stuffer, yes.
Correct.
Yeah.
Do it again.
Otra vez,
Otra vez,
abuelita.
abuelita.
Yeah.
Oye, no.
Don't worry, dude. Raise this left leg up. She's turn this
El otro
way.
pie, abuelita.
Raise your left leg.
No, así como lo hizo la primera vez.
And use my
Dóblalo.
hands.
Para arriba. Eso, abuelita, así.
Este sí no puede.
Raise your right leg.
Ahora el derecho. Eso.
Seriously? Seriously?
No te sueltes, vamos, no te sueltes.
All good. All
No te
good.
sueltes.
No,
All good. Okay, señora.
Sí, está muy bien.
Okay.
Muchas gracias. doctor.
Bienvenido.
Thank you,
Welcome.
doctor.
You got it.